on Friday night, this is Friday the 20th of March, when someone came into my hospital room and told me, we have to intubate you. I was very scared. That was when I thought, I hope I make it out of here alive.
Today on Law Next, David Latt, lawyer, journalist, legal recruiter, and founder of the blog Above the Law, on coming back from the brink of death, his frightening and inspiring story of 17 days in a New York hospital fighting COVID-19. This is Bob Ambrogi, and you're listening to Law Next, the podcast that features the innovators and entrepreneurs who are driving what's next in law. We'll get to today's interview in just a moment, but first, let's hear from the sponsors who generously support Law Next. And now, on to this week's interview. David, welcome to Law Next.
Bob, thanks for having me.
David, we are all so happy and so thrilled to hear that you are on the mend and that you're recovering. How are you doing right now?
So I'm doing okay, Bob. Just a little hoarse, as you can hear, and I get a little winded. For example, if I climb a flight of stairs or walk across a room. My lungs really took a beating from the illness and also from being on a ventilator for 6 days. And so I just am adjusting to everyday life again. But mainly, besides the hoarseness and the shortness of breath, I'm doing okay.
Yeah. And what's the prognosis? Do you expect your lungs to recover fully?
So I actually have to see a pulmonologist in a few weeks. They will get better than they are now. It is possible I've sustained some permanent damage, but I think it's a bit too early to tell. I have a lot of breathing exercises to do. I have this device called a spirometer that helps me practice my breathing, but it's a little too early to tell.
You're 44 years old. You're relatively young, certainly from where I stand. You're a young man. Two-time finisher of the New York City Marathon. I mean, based on what we thought, at least as of the time at which you became sick, you were kind of the poster boy for someone whose symptoms should never have really become as severe as they did, right?
Well, overall, I'm healthy. I don't smoke. I barely drink. I don't use drugs. I'm not overweight. I don't have hypertension. But I did have one thing in my background that I think made me more vulnerable. As a child, I had asthma. I grew out of the asthma for the most part, but as an adult, I have what's called exercise-induced asthma. If I work out too hard, I get wheezing. It was not really a problem. I would just use an inhaler. It was well managed, as they say. Didn't stop me from finishing the marathon or doing classes at the gym. But I think the asthma did make me more vulnerable to a bad case of respiratory distress as a result of COVID-19. A part of it is it makes your immune system more sensitive. So when I had the virus, my immune system essentially overreacted and turned on itself. My body turned on itself. So I think there was that danger. So I do think it's still relevant for people in the sense that there are a lot of people out there who think of themselves as in good health, but they could have a vulnerability which they may know about or which they may not. For example, I've since heard online, for example, over Twitter, from people who discovered when being tested for some other thing that they actually are missing an enzyme that offers lung protection. So there could be people out there who have something that makes them vulnerable that they don't even know about, which is why I think people need to take COVID-19 quite seriously, even if they're overall pretty healthy.
And in your case, you have kind of a striking example because your husband, Zach, also came down with COVID-19 within a couple of days of you beginning to show symptoms. But he had, I guess, what they call a relatively mild case, right?
Yeah, it lasted about a week. The symptoms were like a medium level flu. He had a cough that lingered, still has a little bit of it. Maybe not quite a cough, an upper respiratory thing. But yeah, it hits people in very different ways. Research is now showing that a good number of people may also be asymptomatic, meaning they have no symptoms at all.
Yeah. You were hospitalized for 17 days on a respirator in ICU part of that time. we're at a time on the day that we're recording this. Yesterday brought a single day record number of U.S. deaths in the United States, 1,200 yesterday, up to 12,000 deaths in the United States in total. Was there ever a time during this ordeal that you wondered whether you were going to be one of those numbers?
Yes. One particular moment, namely when I was about to get intubated or put on the ventilator, because I had heard and also read, but I'd heard from my father, who's a physician, that it's a risky procedure and not everyone who gets put on a ventilator makes it. And so on Friday night, this Friday, the 20th of March, when someone came into my hospital room and told me, we have to intubate you, I was very scared. That was when I thought, I hope I make it out of here alive.
What's probably really difficult for people in the hospital, I don't know whether you were able to kind of communicate with others who were in the hospital with this while you were there, but what makes this so different than hospitalizations of the past is that you're there alone. You can't have your family can't come and be there with you. It must have been hard for you, hard for Zach, hard for your parents.
It was because COVID-19 patients are quarantined, so you can't be visited. And for my parents and my husband, it was hard when I was on the ventilator because they were desperate for updates about me. I was in the intensive care unit, the ICU, critical condition, but they couldn't go to the hospital to check in on me. They just had to wait by their phones for the hospital to call.
One thing I know that you were aware of while you were in there was really the overwhelming outpouring of support for you on social media. There was a dramatic reaction to the news that you had become sick. There were people following you closely. Did that help you at all? Was it
Oh,
at all?
Absolutely.
Yeah.
I mean, as I tell people, I don't know that I would have made it through, my family would have made it through without all the support we received. We had so many people just praying for us, thinking of us, sending good vibes our way, friends, family, total strangers, people I met on Twitter or Facebook, or people who emailed me. So it was really touching, and it helped me through this ordeal to have this outpouring of love and support from all over the place.
David, what first made you suspicious that perhaps you should see a doctor? What were the symptoms initially?
So the first few days, the first week, I just had symptoms like the flu, but about a week in, I started to get a cough and shortness of breath. The cough maybe 5 days in. The shortness of breath is what scared me, and that's what brought me to the emergency room.
Yeah, and I assume if you have asthma, you've probably got an albuterol inhaler or something like
I do.
that. And
did that
offer any relief at all? Or
I was using it, but it wasn't as effective. It wasn't really doing the trick at a certain point.
Yeah. So as I was following your case, as I understood it, I mean, when you first contacted your doctor, they told you to take some cough medicine and call them in a couple of days.
Yeah, they thought it was the bronchitis and flu. They gave me some cough medicine. They gave me some antibiotics, but they turned out to be incorrect. Look, I mean, in their defense, I guess, in early March, there were very few cases, which is why initially Zach and I thought we can't have this. Turned out we did. But in early March, there were something like maybe a few dozen cases, under 100 in New York, confirmed cases. So it was a different time. Whereas now, I think people get a slight twitch in the throat and they think they have it. Whereas I think back then we were on the other side. We thought, oh, nobody gets this. This is just something you see in the news. It's not real. It's not like day to day for normal people. But no, we had it.
Yeah, you wrote somewhere, I forget whether this was on your Twitter feed or elsewhere, but that at the point that you started feeling poorly, there hadn't yet been even 50 confirmed cases in New York City.
Yep.
So you were really early. So that happened, and they sent you home, and you got worse. You began to feel fever and chills, or maybe you already. I guess you already were at that point. And then, so what happened then? What did you do next?
So when I had the shortness of breath, that's when I went to the emergency room. I went first on Sunday, March 15, and I asked for a coronavirus test, but they wouldn't give it to me because there are these strict guidelines about who could get tested, and I hadn't been to any outbreak country, nor had I interacted with any known carrier. So I came back the following day, and by then I had to be hospitalized because I couldn't breathe. And also on the Sunday, they had given me this cold flu test, which had come back negative, meaning my symptoms were not caused by any of the common strains of the cold or flu. So that was another reason to actually give me a COVID-19 test. That's if you have flu-like symptoms and then you get a negative cold flu test, you can cite that in trying to get a COVID-19 test.
Yeah, well, again, I mean, I guess you didn't at that point fit the profile of what everybody thought we had to. I mean, we learned a lot more even since then. But again, in one of the posts that you put out during that time, you described it as having to jump through Kafka-esque hoops to get the simple test that would have let you know.
No, exactly. I mean, basically, that Sunday they sent me home, possibly knowing that I had coronavirus, back into the community.
Yeah. You got into a cab and went home.
Exactly.
Yeah. So now it was this March 16th is when you went back again. Is that right, to the emergency room?
And that's when they admitted me. And after they admitted me, they gave me the test for coronavirus. And it took a little while. I was up in my hospital room already. But then the doctor came in and said, yes, you have the novel coronavirus.
And again, according to you tracked this so much at that point, you were New York City's 464th confirmed case.
Yeah, something like that. I mean, now there have been more than 100,000 cases, and those aren't even necessarily all the cases being counted. But yeah, I was an early adopter.
Yeah. Oh, you're always an innovator, David.
Yeah, exactly. Right.
Always ahead of the curve.
That's what the podcast is about.
It's good. It's good that we can laugh about it now. But did you ever have any understanding of how you contracted the virus?
No. It's so-called community spread. I went back and looked at my appointment book. I was doing all the normal things New Yorkers do. In the 2-week period leading up to my symptoms, I went to the gym, I went to the theater, I used the subway. I have no idea where I could have gone it from.
We'll get back to my interview in just a moment, but first, let's take a break to hear from the sponsors who generously support Law Next. And now, let's continue this week's interview. And again, something you wrote somewhere, you alluded to having given the virus to your husband, Zach. I mean, what makes you think you did it as opposed to him becoming infected in some other way?
That's a fair point, Bob, actually. We've always assumed that because he came down with symptoms a few days after I did. It's also possible that he got it from some other source, or maybe we got it from the same source and it just manifested itself at different times in our bodies. I actually don't know. We've always assumed that, but that's actually a fair point.
Yeah, and I know that as soon as you were at all fearful about this, your son went to stay with your parents.
Yes, we shipped him off to the country.
To the
suburbs,
where I'm sure he was well taken care of.
Yeah, no, and of course he didn't understand what was going on, but as long as he gets to watch the occasional Wheels on the Bus video, he's happy.
Yeah. So once you were admitted, I know that it got to a point where it became more serious. Were you kind of stable for a while and then it changed, or what happened?
So I was there for a couple of days. I was getting supplemental oxygen to help me breathe, which they had started in the emergency room and continued. But it was basically about 5 days in. Friday, the 20th, I'd been admitted on Monday, the 16th. That's when suddenly my lungs were filling with fluid and my oxygen levels were dropping. And that's when things took a turn for the worse.
And what happened then? It was
That's
you were
when I was
intubated?
told. That's when I was told I needed to be intubated. Yeah,
And that was sometime
it was
late March, early
20th
March
into the
21st, right?
21st.
Early in the morning of
Yeah, it
March
might have
21st.
been. I think it was after midnight, so
Yeah.
technically it was the 21st, but it was the evening of the 20th. Yeah.
So you were awake then, obviously, because you were aware of what was happening.
Yes, but that soon changed because when they intubate you, they give you sedation and then they give you a paralytic so you don't move when the breathing
Right.
tube is inserted into your mouth.
Right.
And I fell asleep pretty quickly with the sedation, and I'm glad I did.
Yeah. And then while you were intubated, are you pretty much kept out of it throughout that time, or are you at all aware of what's going on?
You're not really that with it. My memories of the intubation are very vague. It
Yeah.
felt like there were a million people in the room. It felt like something out of ER or something. I mean, it's pretty intense. But then I fell asleep, and I don't even remember my time on the ventilator. Some ventilator patients have terrible nightmares or hallucinations. For me, it was like those 6 days just didn't happen.
Yeah, I seem to remember my son, who has very severe food allergies, once had to be intubated, and
Oh, wow.
and I seem to remember that I think they actually gave him something to induce amnesia so that he wouldn't remember it.
Oh, wow.
And
That's
I don't know
interesting.
whether that's a standard procedure or not, but I know
Huh.
he was pretty out of it during that time.
How long was he on?
I think, as I recall, it was 3 days. This was
Okay.
more than 10 years ago now, but
Okay.
this is
Yeah.
my son who produces this show. So
Oh, wow.
he would normally be here to tell me, but he couldn't be on it with me today. But yeah, so I understand it's a horrible procedure. So the next thing you know is what? I think it was on March 28th that you were extubated.
It was around
Yeah.
it was around 6 days. It might have been around the 26th, I want to say, or Thursday maybe. I think I posted later,
Yeah.
but that was partly because I think I posted and said I had been removed from the ventilator because I tried to be fairly real time about my updates, but
Yeah.
right after coming off the ventilator, I was a mess.
Yeah.
So it was around the 26th, I think, that I got off.
Did you at that point become more aware of your situation? Were you at that point saying, "Oh, this is good news. I've been on a ventilator and now I'm off, and that suggests I'm moving in the right direction"?
Yeah, no, I was conscious of things going in the right direction. One thing I didn't realize until, honestly, I got out of the hospital was how dire my situation was. Because when I got off the ventilator, I thought, okay, that's great. I'm awake again. But I didn't really know what it was like for my husband and my parents as they were waiting, and I was in critical condition in the ICU for almost a week. They didn't tell me until, and they wanted me to focus on my recovery. They didn't really tell me until after I got discharged what a difficult time that was.
Yeah. And during that time, at some point during that time, I mean, there's been obviously a lot of controversy in the news about the president's comments about hydroxychloroquine, but you were in fact treated with that at some point.
Yes, I received hydroxychloroquine and azithromycin, which is the combo everyone's talking about. I received an antiviral called Calitra, and I also received an experimental drug for my lung problems when I was on the intubator called clazakizumab. So I received all these different things, and I'm glad I did, but I can't really say what did the trick. People often say, are you a big supporter of this drug or that drug? But I don't really know what did it for me. I mean, I'm grateful to the doctors and nurses at NYU Langone who saved my life and got me well. But and I'm grateful to have gotten these meds. But I don't know necessarily which one was which one did the trick. Or maybe they all helped. Maybe none of them helped. Maybe they worked together. Maybe it was just the supportive care I received that got me better. I don't know.
Yeah, you don't know, and they don't know, right? I mean,
no, my doctors were not able to say, "Oh, this is what did it."
So probably the best post in this series was came on April Fool's Day of all days, in which you said this is not an April Fool's joke that you are finally being discharged.
Yep, that's right.
Posted your final hospital bed selfie for the world to see. That must have been.
No, exactly.
Yeah, I mean that must have felt pretty good.
Yeah, no, it was good. I mean, look, I was well taken care of in the hospital, but as they say, there's no place like home.
Yeah, I know it. So, what was the care like? I mean, obviously you received excellent care, and you've written about that. But what was the emotional state of the medical professionals who were treating you? I mean, were they stressed? Were they concerned?
So
Not
they
about
were
you
amazing.
per se, but about the.
They were so calm and collected and patient, and some of the patients were very annoying. I mean, I try to be a good patient because I could tell they were overwhelmed. They were dealing with something that they hadn't dealt with before. But as I got better, I got moved from a private room to a shared room, which I shared with up to 3 other patients. Some of the other patients were really so annoying. There was this one guy who would just have loud cell phone conversation with his girlfriend and his daughter for hours. There was another patient who refused to turn off his light when trying to sleep, and you're all in one room, so it's keeping you up. There was the loud guy with all the cell phone conversation. He would ring the nurse call button every 5 minutes. They didn't respond to him immediately. And the nurses, and it's a cliche, but they really were like saints or angels. I would have lost my temper with this guy so long ago, and they would just patiently explain everything to him. I don't know how they do it. I would have. I mean, some of the patients are, and look, I don't blame the patients entirely either.
Sure.
They're suffering, they're in pain, they're scared. I get it. But I mean, the nurses really took it to another level. I don't know how they do that. I could never do what they do.
I think you wrote that you were only the 3rd person to have come off a ventilator who had gone on a ventilator at your hospital for COVID-19 related causes. The studies so far don't paint a good picture of that. I mean, more than half of people who go on a ventilator, they don't pull through.
Yeah, which is scary. So when my dad had warned me, before I got intubated, he said, you don't want to get intubated. Not everyone comes back from that. And even though that was a scary comment, he kind of had a point. I mean, the early research shows that it's probably under 50% of intubated COVID-19 patients who ultimately successfully make it off the ventilator. Sometimes they try to take them off and they have to get put back on. Sometimes they pass away. Sometimes if they're on there for a long time and things aren't getting better, they decide, in consultation with the family sometimes to remove the ventilator. I mean, there are a lot of different ways it can play out, but I feel very lucky that it turned out okay as it did for me.
You were a journalist. One of the interesting side stories to your story is that at least two major newspapers were working on your obituary. And you also reported that a number of websites in the Philippines were reporting that you had died.
Yeah, which is kind of funny. I mean, look, like a lot of journalists, I have a Google alert for my name. So when you see your name and, died or dates of birth and death, you think, what? So yeah, that was kind of surreal.
I don't know if you had a chance to read the report today in the New York Times that was critical of state and city officials in New York, insofar as it suggests that they could have done more earlier on to impede the spread of the virus there. And at the same time, certainly both the mayor and the governor in New York have also been praised for the way they've handled this situation. But I mean, do you, in retrospect now, do you feel that officials, whether federally or in New York, should have done more earlier on to constrain this virus?
Hindsight is 2020, but I do think that yes, more could and should have been done in hindsight. I mean, one thing I think of is just obviously the testing regime, because we would be able to control this better if we had widespread and easy testing, on demand. While some countries or communities, I think, even have regimes where certain people must get tested. But I think that is one failing. There's been a lot of media coverage about ventilators and how government officials haven't been on top of that as they could have. So I think that is certainly an issue. But I do think that recently they've upped their game. So it now seems that it's being taken seriously as it should be.
David, I don't want to stress your voice more than I have to today, or exercise your voice more than it wants to be exercised. But maybe just one final question: what do you come away from this experience with? How has it changed you? What have you learned from it?
Yeah, so I do think, and again, it's kind of cheesy, but I do have a newfound appreciation for life and for human relationships. You just take so many things for granted, but when you come close to losing something, you just appreciate it more. So I think I do just, my mother told me, it's like it's like you've been given a second life. So I really do feel that way. And I'm also so grateful to everyone who gave me so much support during this whole thing. So that's another way I feel that I've been changed. When you have a large network as I do, it's very easy to take people for granted. Oh yeah, that person. But I really just feel so grateful to everyone who helped me through this. So I think that's one way I've been changed. And I also do think that I'm more emotional. I think I'm more sensitive. My heart really breaks for people who have to go through this without the kind of support that I did. I read these stories sometimes in the paper and I cry. Like it's just, I don't know, maybe, who knows, if we all revert to our means, maybe in a couple of weeks or months, I'll be just like self. But I do hope, there's a silver lining. I do hope that some part of this experience actually does stay with me, the part that really is grateful and appreciative and connected to others.
Yeah, well, everybody who knows you personally knows that you're a good man and you're a very kind and thoughtful man, and I think a lot of people are awfully glad that you pulled through this, and we will continue to follow your story. I really appreciate your taking the time to be with us today.
Well, Bob, thank you for those kind words just now and for your support and concern during this whole thing. I know you were definitely tracking it and sharing it with others, and thank you for having me on the show today.
All right, and all the best to your husband and your son and your family. we'll see you around the conference circuit if that ever starts again.
Yep. Totally. As the Queen says, we will meet again.
Yes. All right, David. Stay well.
Hey, thank you.